Hi, my name is Haley, and I'm going to be instructing a patient on a metered dose inhaler. For this skill, I'm going to be playing the patient and the medical assistant. So let's begin. First, I'm going to start off by washing my hands and assembling my equipment. Okay, and for this skill, I only need my inhaler, in which I have. So before I go doing any further in this skill, you always want to identify the 6 rights. This being the right patient, the right medication, the right dose, the right route, the right time, and making sure that you are doing the right documentation. So then, after you ensure that your 6 rights have been gone over, you want to check the medication for the 3 befores, which you're going to verify the medication, dose, route, and time 3 times before giving. So you're going to check it before you remove it from the storage, and then you're going to check the another before as you're preparing the medication, and then you're also going to check again before that you give the medication to a patient. So now I'm going to be demonstrating the use of this inhaler. So first, you're going to remove the cap from the inhaler, and you're going to shake it well. So you're going to instruct the patient, so myself, to sit upright, to tilt your head back slightly, and to exhale fully. So tip back lightly, exhale fully. Okay. Now, while holding the inhaler, the patient needs to open their mouth wide and place the inhaler anywhere from a ½ inch to 2 inches away from the in front, or like away from the mouth. And then when you're like bring the inhaler over like to the face, to close the mouth and lips around the mouthpiece here, like this. So now that we have put our mouth around it, we are going to have our patient inhale slowly and exhale, and like exhale one more time. So we're going to inhale slowly, and then when we on the next breath, we are going to press down on the inhaler, and you're going to inhale the medication by pressing down. For this case, I'm going to put my mouth around, and for like practicing purposes, inhale, exhale. On the next breathe in slowly, okay. The patient should inhale slowly and deeply for the next 3 to 5 seconds, as shown. So then you wait 1 to 2 minutes and repeat the steps for each puff needed, as ordered by the provider. So if you needed, 2 puffs to repeat the steps. In my case, we only needed 1. So I would check the patient for any unusual side effects. For me, I'm feeling fine. I am not lightheaded. I'm not feeling like shaky, and I don't have any unusual symptoms. So after that has been done, I'm gonna go ahead and wash my hands. Okay, so now that I've washed my hands, I'm gonna go ahead and replace the cap on my inhaler. And if the inhaler contained a steroid, I would have the patient rinse out their mouth with water after each treatment. I also will rinse the mouthpiece and the cap, and I will let them air dry until the next use. And then you also just want to remind the patient to clean the inhaler by rinsing the mouthpiece in warm water, and to always follow the prescription dose. And then after my my medication administration was done, I would make sure that I document here that we were instructed on using an MDI in the patient's chart. And then depending on the office policy, and answer any questions, and keep an eye on the patient to make sure that no unusual symptoms arise.